Hello, I'm Veronica Rodriguez. I'm doing a demonstration for my speech class, which is professional speech. Today I'll be talking about drawing blood. My main goal today was to teach and inform people on how a blood draw is performed. First, I would have a patient, and most of the time patients come to the labs or to the doctor's office with problems, and the doctor will determine any problems by doing blood draws of certain kinds, and the doctor would just order a lab, and then a nurse or a phlebotomist would be doing the blood draw. What I have here is the blood draw kit. They're not all the same, but they're all similar. And I would wash my hands, which I already did. So I would open the blood draw kit and get my supplies ready. Then, of course, the patient, I would explain to the patient, sir, I'm going to draw your blood today as your doctor has ordered to test for whatever problems you might be having, okay?
Yes, ma'am.
All right. So there's gloves in here. In his case, we'll pretend that they're drawing a complete metabolic profile, which requires a tiger top or a red tube with gel. So I'll don my gloves, and then I would assess the patient's arm to see if he has a good area to do his blood draw. For example, look at the veins, feel, and if I don't feel anything or see anything, I may ask him to squeeze the hand over and over. Sometimes that helps the veins to come out, and I may tap it a little bit just to search for an area that would be good. Sometimes the veins will, appear. Sometimes they're flat. Either way, we have to try to do it by feel. There's persons of darker skin that sometimes you're unable to see it, so it's completely by feel. Then I would get the rest of my supplies ready. My Band-Aids. And you always ask the patient if you're allergic to Band-Aids or any type of adhesive that we might be using. Some of the blood draw kits do have iodine. It's not necessary to use iodine. Some labs or hospitals may require that. Then we use a tourniquet, and this is an attempt also to get the blood to pool in this area, and sometimes that helps the veins appear. In this case, as soon as I put that on, this whole arm is pooling. You can see the smaller veins and then the large vein there that we'll probably use. This is a butterfly and a Vacutainer. There's other forms of needles that you can use, but this seems to be one of the favorites because they're small and easy to maneuver when you're doing blood draws. So I would wipe down, then again down. You can air dry, or you can use one of your gauze and dry it. I'll save that one for afterwards. So then, sir, I'm going to stick you if you're prepared.
I'm prepared.
Okay. After you clean, you shouldn't be touching the area because you would contaminate it again. All right, sir, relax. Here's a big stick. There you go. And then this tube has a suctioning, and you can see it's suctioning in, and it automatically sucks the blood. Then you undo that when you're completed so that you don't have a big backflow of blood when you take the needle out. Once you're done, you remove it from the suctioning device there, Vacutainer. Then you get your leftover gauze. Just lay it there gently and pull the needle out. Then most needles now tend to have a safety device where it allows the nurse or the phlebotomist to just cover the needle so that it's not laying around for the nurse or the patient to get accidentally stuck. Then you may Try not to bandage it before you know that the actual bleeding has stopped. You look, and then If it stopped, you go ahead and wrap it just to make sure it doesn't start up again. Bandage the patient, remove all this, you put it in a Vacutainer holders or the biohazard disposal needle holders. Everything is disposable. We don't use the same thing on any of the patients. Then this becomes labeled and sent to the lab. All right, as you can see, it's very common. A lot of this is done every day, day in and day out. The main function, of course, is to do testing for doctors to determine if there is any problems with the patient. It could be testing cholesterol, sugar levels, anemia, many things. So after that, you can then tell the patient we're through here and he can go on his way.
Thank you.